The brain is the master controller of all bodily functions and the hub of the nervous system. It is the fattest and most complex organ in the body, consisting of billions of nerve cells that link and interact with each other through an intricate network of neurons that spans the entire body and controls a variety of bodily processes, including movement, emotion, sensation, and other physiologic elements. Secondary or metastatic brain cancers are those that originate in other organs and spread to the brain. Because of the body's blood-brain barrier, brain cancers seldom spread to other areas of the body, except from the spine. In this video, we are going to tell you the top 9 most common warning symptoms of brain tumor. So watch the video from start to end. 1. Headache. Not every headache indicates the presence of a brain tumor. It affects only a small percentage of persons who get headaches. Tumors growing quickly and growing in some places, such as the posterior fossa, are known to produce more headaches than others. The characteristic headache associated with a brain tumor is less common than tension-type headaches or migraines. Imaging, MRI/CT, is a crucial and required step in identifying the source of the headache. Possible hypotheses for the cause of tumor-related headaches include increased intracranial pressure brought on by the tumor, neurogenic inflammation, and central sensitization via trigeminy vascular afferents on the meninges or cranial nerve. 2. Seizure. An abrupt spike in brain activity is called a seizure. Depending on which lobe is affected, seizures might have different characteristics. While some seizures may be very insignificant, others may be severely incapacitating. The most typical sign of a brain tumor is epilepsy, which is also widely referred to as convulsions. 20 to 40% of patients experience initial symptoms, and an additional 20 to 45% experience convulsions over the duration of the illness. Seizures are most common, 70 to 80%, in glioneuronal tumors out of all forms of brain tumors, particularly in individuals with frontotemporal lesions. Seizures are also seen in 60 to 70% of patients with low-grade gliomas, 20 to 30% of patients with meningiomas, and 20 to 35% of patients with metastatic brain tumors. After a tumor is surgically removed, between 60 and 90% of patients no longer have seizures. 3. Nausea or vomiting. Vomiting or nausea can be brought on by intracranial pathologies like brain tumors. Patients with brain tumors may experience nausea or vomiting due to elevated intracranial pressure or direct stimulation of the vomiting area in the brainstem. Nausea and vomiting are also typical signs of other diseases, such gastrointestinal tract infections. Therefore, it's critical to check for additional neurological symptoms and determine the precise cause of nausea and vomiting. 4th, issues with the vision. A brain tumor that is located near the optic nerve or area that affects vision may cause symptoms like double vision, blurry vision, hazy vision, partial or total blindness, color blindness, and loss of peripheral vision. Either directly from the tumor or indirectly through increased intracranial pressure and optic nerve injury, the tumor may cause optic neuropathy. Diplopia or double vision is caused by malfunctioning of the cranial nerves 6, 3, and 4, and visual blurring is caused by involvement of the optic nerve. 5. Peripheral neuropathy and neurological symptoms. Neurological morbidity can be significantly increased by brain tumors and CNS malignancy. The condition can affect the peripheral nervous system as well as the central nervous system. Because the cancer involves a vertebra, it can spread to the spine and frequently result in spinal cord compression or cord transection. In addition, it may lead to hypercoagulability, interfere with coagulation, or create cerebrovascular problems. A tingling sensation on one side of the body, jerky or uncontrollable movements, and facial or arm muscular weakness are a few neurological signs. Patients may also have problems with control over their bladder and bowel motions in situations when the spinal cord or nerve root is affected. 6. Confusion and issues with self-identity. A brain tumor may change a person's neurocognitive function. It's also possible to experience self-identity confusion. Changes in consciousness and neurocognitive domains may result from the tumor and may have an impact on one's sense of self. Neuropsychiatric symptoms may appear as the brain tumor's initial symptom in certain patients. Throughout the course of treatment, this patient will need to have a neuropsychiatric evaluation and assistance. 7. Memory loss and issues with perception and judgment. Brain tumors may impact memory and perception, as well as the neurocognitive domain. The patient might not be able to remember things. Perception may be severely compromised, and signs of a brain tumor, such as delusions and difficulties controlling one's impulses, may also manifest. Thus, changes in perception, personality, and self-identity are influenced by neurocognitive disorders. 8. Sleep-wake disturbances. The most severe and prevalent symptoms that individuals with primary brain tumors describe are problems with their sleep-wake cycles. One of the potential causes of sleep cycle disruption could be a decrease in cognitive impairment, exhaustion, etc. Sleep disorders may also be caused by inflammation inside the brain. Patients who experience sleep-wake disruptions may report problems falling asleep or staying asleep, waking up too early, not feeling refreshed when they wake up, sleeping excessively during the day, etc. 9. Communication issues, language impairment. Semantic processing in speech and visual is done by the temporal lobe. They have the frontal lobe and the ability to make and comprehend language. However, a patient may experience difficulties speaking if a tumor impairs their ability to function. Language impairment, speaking difficulties, memory loss, leading to word loss and poor recall, the inability to judge a discussion, etc., are examples of communication impairments.